Hi guys, and welcome to the Total Knee Replacement Support Group YouTube channel. My name is Tony Maritato. I'm a physical therapist, and today's talk is going to be really interesting. I had the great fortune a couple weeks back now of talking to an individual who called to discuss the potential for jogging after a knee replacement. Now, full disclosure, most of the clients, most of the normal human beings I am fortunate enough to work with on a daily basis are, if they're running 2 miles, 5 miles. I run 2 to 5 miles. Like, that's about my limit. I love it. I enjoy running. I enjoy nature and getting outside. This particular individual was one of those people that's just in the upper echelon of performance. She was running, it was either 50 kilometer, I think it was a 50 kilometer race through rugged terrain, not on the road. And she wanted to know if she had a knee replacement, could she return to running? And I was just blown away. I was floored, like somebody running 2 marathons at the same time back to back. That's just crazy to me. But I am so happy there are people like her out there doing it at the age of, I think she was in her mid-50s, just because it is such a phenomenal feat to see a human being do something like that. So first, once I pulled myself back up off the floor after hearing this, I was thinking to myself, well, what does running really mean to this individual, to you, to me, to anybody? I understand the mechanics. I understand, believe me, why the general consensus is no impact after the knee replacement. We don't want failure of the prosthesis. We don't want to wear the joint out sooner than it otherwise would. But like anything, I always have to dig a little deeper as a physical therapist. It's kind of my compulsion to go deeper, ask deeper questions. And I think about it and I say, well, while yes, 1000% there's risk of wearing out the prosthesis and doing these things, there's also calculated risk to walking across the street, right? To driving my car to work every day. And so I have to wonder, for somebody who has achieved this kind of level in performance, who's able to go a 50K race on 2 feet, this activity must be such a huge part of this individual's life. To just give it up, that's a hard pill to swallow, And so then I started looking at, okay, well, what are some options here? What can we really do? How can we look at this in different ways? And I wonder first, well, if we're looking at wearing out the prosthesis as a major risk factor, what if there are ways to reduce the compressive forces, to spread the load? My background's kinesiology, I love biomechanics, and so when I think about force and ground reaction force and impact, we certainly know that if she was running on pavement or a hard surface, there's going to be higher forces than if she's running on more varied compliant surfaces like gravel and grass and sand and different things. I don't know where she's running. I'm just brainstorming at this point. And so I'm thinking also, if she's running on various elevations, as she's running uphill, for example, there's going to be less heel contact, less impact. The forces are going to spread over a longer period of time. Certainly her body, like this is a major part of this, her body has to be in such incredible physical shape, cardiovascular shape, health, that how do you measure that? How do you measure the difference between an individual who's dealing with cardiovascular disease and diabetes and hypertension and so many of the chronic conditions that we see on a daily basis, who maybe is not doing high impact activity? So we're preserving the health of the prosthesis, but the health of the rest of the body needs a lot of work, right? And everybody is working toward a better, healthier body. But how do we offset that with somebody who is in phenomenal cardiovascular shape? So maybe we have a higher risk to implant failure, possible sooner revision, but in exchange, we're gaining incredible health in the rest of our body. We're gaining personal life satisfaction and enjoyment. You know, I don't know. I'm going to take a personal minute here, and I'm going to go back to my mom. Now, my mom is deceased. She passed away a couple years ago. My mom was a type 2 diabetic and cardiovascular disease and multiple complexities, comorbidities. But my mom was one of those people, she would rather live a shorter life the way she wanted to live her own life than to live a couple extra years longer but not be able to do the things that she wanted to do. That was a conscious decision. That was within her rights as an adult, as a human being. And so I have to respect her decision when it comes to something like that. The same holds true for me with what my patients want. Now, I would never, as a therapist, I would never go against the recommendations of the surgeon. But at the same time, I have to respect the request of the client, the patient, you, the individual. And so if you want to do something that is so passionate and holds such an important part of your life, of your being, even though the risk is obviously higher because of the loading and the impact to the prosthesis, but we can offset that risk with other benefits that come with that kind of activity. I think these are challenging ethical questions that really take time and really have to be decided on a case-by-case basis. You know, so to say across the board, no, nobody can ever do that, I think that's irresponsible. I think that's a bad decision. I think for you, for your surgical team, for your therapy team, to sit down and have a real conversation. Like, let's go to the other extreme. Let's talk professional sports, right? Let's talk football. Is there really any doubt professional football players are at a higher risk for injury? Is there any doubt they're at a higher risk for trauma to the brain, concussions, and down the road, problems and complications associated with that? I don't think there is any doubt. But on the same token, I think that they're willing, consciously willing, to make the decision to take on, assume that extra risk, because that's what they do. That's part of their career. That's part of their passion. That's the way they make their income. So, you know, my goal in this video, if you guys are still watching, and I thank you if you are, and if you are, please take a minute while you're listening. Give me a thumbs up, like the video, and subscribe to the channel if you haven't. But I think these are the kinds of conversations that need to be had. Hopefully, you're having them with your surgeon before you ever have a knee replacement or any other kind of surgery. If not, if the surgeon doesn't have the time, which I know they're busy, it's absolutely a conversation you need to have with a physical therapist, whether it be the therapist you're working with, whether you jump on a call with me. There is a link in the description if somebody wanted to reach out to me and do a telephone consultation, how you can do it. But the idea is that these are really, really complex decisions that need to be made, and they're decisions that have long-term ramifications. I know several of you in the group, you're incredibly successful power lifters. You want to get back to heavy squats. The same thing holds true for you. You know, how do you balance? How do you weigh the risk to benefit, the risk reward? Maybe you do a squat and in your non-surgical knee, you rupture an ACL. You have some sort of, you know, catastrophic injury. It absolutely can happen. We need to weigh those risks, and we also need to weigh the risk of how important is this to my life? How much of my identity is wrapped up in this particular activity? I think those are really, really interesting questions. So guys, I hope that this at least gets your minds working. I know I didn't give you an answer, but I don't think there is an answer. It has to be decided on a case-by-case basis. But I do get a lot of questions. I do get a lot of questions about, can I return to run? Can I do CrossFit? Can I squat? Can I lift? What can I do? We need to think about these, and we need to be very specific about how we think about these, intentional about how we think about these questions. So let me know in the YouTube comments, what are some of the challenges that you've been facing? What is something you want to get back to doing that you used to do at a relatively high successful level that maybe you've been told you're not allowed to do, not able to do, you just feel like you can't do it? I would love to hear from you. So please let me know. I read every single comment, even if I don't reply to them as quickly as I would like to. I absolutely read every single one of your comments. Guys, as always, I appreciate your time. Subscribe to the channel, like the video, and I'll catch you on the next question.